Good evening, and welcome to my presentation on homelessness and substance use disorder. According to the American Addiction Centers, research shows that approximately 1/3 of homeless individuals have substance use issues, and 2/3 of homeless individuals have reported having a history of substance use disorder. There are two types of homelessness. First, we look at the chronically homeless. Chronically homeless people experience long-term homelessness, frequently rotating through a community's various shelters and the streets. They typically have health or substance abuse problems in addition to extreme poverty. This population is best served by permanent supportive housing, which combines housing with intensive rehabilitation, treatment, and other social services. The transitionally homeless people generally move quickly through the homeless assistance system once they are able to access it. Their principal need is housing, plain and simple. Income supports, including employment that pays a living wage, is critical to keeping people and families housed. The transitionally homeless include people that work in entry-level jobs as well as those living on fixed incomes, who barely earn enough to pay for their housing costs and other necessities such as food, healthcare, and daycare. These individuals and families often live paycheck to paycheck or month to month and may be one paycheck away from not making the mortgage or rent payments. There are many reasons for homelessness. These include poverty, underemployment or unemployment, lack of affordable housing, domestic violence, a lack of affordable health care, and mental illness or substance use disorder. So with poverty, a significant portion of the individuals experiencing homelessness are living in poverty with insufficient income to afford housing, food, and other necessities. For the unemployed or underemployed, job loss or difficulty finding stable, well-paying employment can lead to an inability to afford housing and other basic needs. Lack of affordable housing. There is a severe shortage of affordable housing options, which forces many individuals and families into precarious living situations of homelessness. Domestic violence. Experiences of trauma, including physical and/or sexual abuse, can have long-lasting impacts of mental health and well-being, potentially contributing to homelessness. Many individuals, particularly women and children, flee abusive situations and become homeless when they have nowhere to go. Difficulties in families or romantic relationships can lead to a loss of social support and housing, as well as social isolation and a lack of access to social services. Lack of affordable health care. Physical and mental disabilities can create barriers to employment and housing stability. Health care is very expensive, and many people are uninsured or underinsured. This means spending large amounts of money on health care while struggling to pay for rent, food, and utilities. It can also mean neglecting routine checkups and procedures, leading to higher medical costs down the road. One serious injury or accident could push an individual or family into homelessness. And finally, mental illness and substance abuse can severely impact an individual's ability to maintain housing, employment, and social support. There's a two-way connection between mental health, addiction, and homelessness, which is very clear. Having a mental illness or addiction makes a person more vulnerable to homelessness. It makes it more difficult to find permanent housing, while a lack of stable housing exacerbates one's mental health and addiction issues. Information and statistics. According to the National Coalition for the Homeless, substance abuse is more prevalent in people who are homeless than in those who are not. In many instances, substance abuse is the result of the stress of homelessness rather than the other way around. Many people begin using substances as a way of coping with the pressures of homelessness. The 2020 U.S. Department of Housing and Urban Development's annual homeless assessment report to Congress reports that on a single night in 2020, 580,000 people experienced homelessness in the U.S. According to the 2024 annual homeless assessment report, 257,000 homeless individuals had a severe mental illness and/or chronic substance abuse issue. More than 40% of homeless individuals had a substance use disorder. In this same report, more than half of the adults in permanent supportive housing, which is an intervention that provides affordable housing to the chronically homeless people, had a mental health disorder or a co-occurring mental health and substance use disorder. The Substance Abuse and Mental Health Services Administration, or SAMHSA, points out that people who are homeless have a high risk of overdose from illicit substances. One study found that homeless people had a higher risk of opioid overdose, while an adjusted risk rate of 1.8% for homeless versus 0.3% for low-income people who had housing. Most research shows that around 1/3 of people who are homeless have problems with alcohol and/or drugs, and around 2/3 of these people have lifetime histories of drugs or alcohol use disorders. According to SAMHSA, 38% of homeless people abused alcohol, while 26% abused other drugs. In a 2014 report from the United States Conferences of Mayors indicated that substance use was one of the top 3 causes of homelessness in single people as well as families. So now let's look at some of the causes of homelessness. For coping mechanisms, stress and trauma. Homelessness is a highly stressful and often traumatic experience marked by uncertainty, fear, danger, and lack of basic necessities. Individuals may turn to substances as a way to self-medicate, seek temporary relief from intense emotional and physical pain associated with their situation. Harsh conditions of living on the streets or in inadequate shelters exposes individuals to extreme weather conditions, hunger, and a constant lack of safety and stability, driving some to use substances to cope. And then we have mental health and co-occurring disorders. Self-medication for individuals with untreated mental illness may use substances to alleviate their symptoms, leading to a complex interplay known as dual diagnosis or co-occurring disorders. Substance use can exacerbate the symptoms of mental illness, creating a cycle of addiction and further hindering recovery. For social and environmental factors, lack of support system. Homeless individuals often lack proper support systems, making them more vulnerable to harmful influences, including those who encourage substance use disorder. Substances may be readily available within homeless communities, and there may be a greater level of social acceptance of substance use, making it easier to engage in such behaviors. Estrangement from friends and family due to addiction can lead to feelings of isolation and depression, reinforcing harmful coping mechanisms, including using substances. For predisposing factors, childhood traumatic and trauma and adversities. The ACEs studies is a study that suggests a link between childhood trauma and a higher risk of substance use and homelessness later on in life. Past traumatic experiences, whether predating or occurring during homelessness, can significantly contribute to substance use as a way to cope with emotional stress. Family history. Individuals with a family history of substance abuse may be more prone to developing substance use disorder themselves. And starting substance use at a young age can contribute to chronic homelessness and substance dependence. Finally, a reinforcement of the cycle. When daily survival becomes the primary focus, such as finding food and shelter, long-term recovery efforts can become less of a priority. A lack of resources, such as health insurance, transportation, and awareness of available services, can hinder homeless individuals from seeking treatment for substance use disorder. And finally, homelessness exposes individuals to a higher risk of violence and victimization, further fueling the cycle of addiction and acting as a barrier to the recovery. When we look at risk factors for substance use in the homeless population, we look at environmental situation and situational factors such as stress of homelessness, idle time or too much free time on our hands, the social acceptance and easy access to the substances because on the streets it is more acceptable to use substances. And then street-based activities and victimization. With the level of violence on the streets, it's no wonder that people turn to substances as a way to alleviate the pain of the victimization that they experience. For individual factors, we look at mental health conditions, past trauma, and personal struggles and emotional distress. Co-occurring mental health disorders such as depression, anxiety, and PTSD are prevalent in the homeless population and often contribute to substance use as a form of self-medication. Interpersonal and social factors include a lack of social support and influence of peers. Individuals experiencing homelessness may have limited or no contact with family or friends, increasing feelings of isolation and potentially leading to substance use, which then leads to association with peer groups that engage in substance use and which can significantly influence the individual. And then we look at other factors such as economic and untreated physical health issues. There are advocacy programs for addressing homelessness and substance use. Advocacy programs should focus on increasing access to affordable housing, providing comprehensive medical and substance use treatment services, implementing a housing-first approach, prioritizing harm reduction strategies, and actively involving individuals with lived experience in policy development, all while aiming to reduce stigma and promote person-centered care. Here you'll see a list of advocacy programs for the homeless. You may click on any of these links to get more information on any of these services. The Housing First initiative advocates for policies that prioritize providing permanent housing to individuals experiencing homelessness without conditions like sobriety, aiming to stabilize their lives first and then address the substance use issues. Support funding for supportive housing models with on-site case management and access to treatment services. And then a push for increased development of affordable housing units, including rent assistance programs. Substance use treatment access. We look at expanding access to evidence-based addiction treatment options such as MAT and behavioral therapies such as mental health therapy. We look at integrating substance use treatment services into homeless shelters and other outreach programs. And then ensure equal mental health and substance use treatment coverage under insurance plans. Here you'll find a list of barriers to substance use treatment, which include financial cost, geographical location, stigma, co-occurring disorder treatment availability, and issues that are specific to women, such as childcare, and addressing the issue of where do your children go while you are in treatment. So for women, there's also the stigma of being a mother and being a substance user or having mental illness. So how do people, and how do women in particular, navigate this when there is such a stigma? So for the financial and the cost, many people just can't afford to be in treatment. The financial limitations are one of major barriers that prevent people from receiving treatment. Some insurances will help cover substance use treatment, while many will not. In 2022, 25.6 million people aged 0 to 64 did not have health insurance, with 73.3% of them in households with one or more full-time worker. Even people with insurance may run into problems where they may try to get treatment because plans do not always cover medicated assisted treatment for opioid addiction, for example. And while Medicaid covers medications for substance use disorder, however, many states impose limitations and requirements on what makes it more difficult to receive. With geographical locations, most rural areas you will find do not have treatment facilities or even individual treatment. A large portion of the rehab programs in the United States are concentrated in states with high populations. Conversely, states with low populations tend to have fewer facilities, and many of those states are quite large geographically, which means facilities are more spread out and harder to access for people in rural areas. The stigma around addiction can affect someone's decision to seek treatment. The SAMHSA 2023 National Survey on Drug Use and Health finds that common barriers to treatment include concerns about information remaining private, worrying what others would think or say, worrying about losing their job, home, or children if they checked into treatment, and concerns about how treatment might be perceived by their friends, family, or religious groups. With co-occurring disorder treatment available, many people with addiction also struggle with mental health disorders. When someone has a substance use problem and a psychiatric issue, also known as a co-occurring disorder, it is more difficult to find treatment facilities that will work with both substance use and mental health. Harm reduction strategies. Supporting needle exchange programs and other harm reduction initiatives will help to minimize the risk associated with drug use. This will also help to reduce crime and protect neighborhoods where otherwise may be finding needles laying around excuse me. Support for safe injection sites to help reduce the risk of overdose deaths. So what we're finding is when people have a safe place to go and can be monitored while using these substances, there is a less of a risk for overdose deaths. And to promote overdose prevention measures like naloxone access and training, it is crucial that we provide people with training and access to naloxone, otherwise known as Narcan, because you never know in this day and age when you will encounter somebody who is overdosed. So, barriers to mental health services, as you'll see, many of these are the same as barriers to substance use treatment. So, we look at the cost. Mental health care can be expensive, including therapy sessions, medications, and other treatments. Lack of insurance coverage, high out of pocket cost, and limited income can make it difficult for individuals to afford the care they need. Again, stigma. What would family and friends, colleagues, religious organizations think if I were to admit that I have a mental health issue? A lack of knowledge about available services. Some individuals just may not be aware of the type of mental health services available to them and how to access them, or the potential benefits of treatment. Concerns about a provider and the provider-patient confidentiality. Some people may worry that a therapist or other mental health professional won't understand or emphasize with their experience and won't keep their information private. Difficulties navigating the system. The mental health system can be complex and difficult to navigate, especially during a time of emotional distress. This can include finding the right provider, understanding insurance coverage, and scheduling appointments. A lack of insight. For some people, they just don't understand that they're experiencing mental health symptoms, and they may not recognize that they need help. And they don't have a clear understanding of their own mental health journey. Again, we look at geographical limitations with limited access to mental health services, especially in rural and underserved areas, which can make it difficult for individuals to find and receive care. In some areas, there can be a language barrier, which can make it difficult and even challenging for individuals to communicate with mental health professionals and understand the treatment information. There may be workforce shortages. A shortage of mental health professionals, particularly in certain areas or specialties, can create long wait times and limited access to care. And finally, attitudinal barriers. These include a belief that professional help won't be effective, fear of negative consequences from seeking help, or a preference for self-management. So for mental health services, we look to promote access to mental health services for individuals experiencing homelessness, including crisis intervention and peer support. And then we look to advocate for early intervention and trauma-informed care approaches. Here are some policy examples of ways we can help people who are homeless and have co-occurring disorders. So again, we look at the Housing First legislation, which is mandated that housing is provided to individuals experiencing homelessness without requiring prior sobriety or treatment completion. We look at more funding for homeless outreach teams, supporting teams that actively engage individuals living on the street to connect them with services. This includes outreach workers who actually go to the front lines out into the homeless encampments and try to get people connected with needed services. We looked for Medicaid expansion for substance use treatment, including increasing access to addiction treatment services for low-income individuals, and easier access to medicated assisted treatment, or MAT, as well as services such as needle exchanges or safe injection sites, which are considered harm reduction. And finally, we look to increase funding for supportive services. It is crucial that we allot resources for case management, employment training, and life skill development within the housing programs. These skills are particularly important for somebody who's been chronically homeless and do not know the basic skills to keep up a home, don't know where to start to find a job or to find much needed services. So for specific policy considerations, we look at the funding for outreach and case management, which is allocating resources to support terms or teams that actively engage homeless individuals, assess their needs, and link them to appropriate services. Much needed criminal justice reform, reducing reliance on incarceration for nonviolent offenses and implementing diversion programs to connect individuals with housing and treatment options instead of jail time. This can include programs such as the adult treatment courts and family drug treatment courts. Collaboration between agencies, creating a partnership between housing authorities, healthcare providers, social service agencies, and law enforcement to coordinate services and streamline access to support. Data-driven approaches, utilizing data to identify high-need areas, track program effectiveness, and inform policy decisions. And finally, addressing systemic barriers, recognizing and addressing systemic issues like discrimination, lack of affordable housing, and inadequate access to health care that contribute to homelessness and substance use. We can do so much more. Since substance abuse is both a cause and result of homelessness, both issues need to be addressed simultaneously. According to Didenko and Pankratz, stable housing during and after treatment decreases the risk of relapse. Substance abuse treatment on its own is inadequate. It needs to combine with supportive housing opportunities. It is not enough to just put people into treatment if they do not have safe housing and supportive services. They will relapse. It's not a matter of when, it is a matter of finding them the services so that they do not. It is crucial that we put more emphasis on the homeless population. Here you'll find a list of references to find more information on homelessness, mental health, and substance use disorder. Thank you and have a good evening.